सरस्वती महाभागे विद्ये कमलोचने विद्यारूपे विशालाक्षी विद्यां देहि नमस्तुते. Namaste. On behalf of 48th International Conference on Ayurveda and Fertility 2022, I like to share the causes behind the infertility, taking from the reference from available Samhitas. Many a times we feel that what are the sufficient references of infertility in our classical compendiums so that the treatment protocols will be easier. And therefore, precisely my discussions will be on the possible causative factors in classical text. So before going to the main issue, the point here to discuss that whenever we are thinking the causative factor related to the ladies or the women, that times it is not the particular organ involved for the disease. It is the whole physical, mental, social well-being of either the woman or the gents. So that the holistic approach to the treatment could be satisfied or could be easily established. Therefore, when we are coming across the patient, we should not just think about the genital tract or the particular systems. It is more fine when we will go to understand the conditions through all the aspects of the sarira, the indriya, the mana, how the epigenetic factors are involved with the patient, what are the different positive or negative responses, whether the patient is under stress or relaxations. So the complete message of the health related to infertility issue is that either we should think physical health, that is in terms of the Sarira Dravya Guna Sangraha, or the psychological and adhyatmika issues, that is in terms of Adhyatma Dravya Guna Sangraha, that is the Mana and Atma, the concepts. So it's the real target to diagnose the disease, that how far we can go close to the diagnosis. That was the reasons that is we can satisfy the Nidana Parivarjana concept. That unless and until we will not touch to each and every aspects of Nidana or the causative factors behind the disease, then it may not be, we cannot reach very close to the treatment aspects. So how far the psychology depends or reflects the disease. Therefore, a simple point of anger or krodha. So many times it happens that ladies' mass it's not so expressive. So whatever the problems comes to them, they just try to resolve themselves. So they can create more harm to themselves. They may not speak some things. So that's the simple point of anger can affect the brain-body mass relationship, or we know there's the hypothalamic pituitary and the hormonal axis. Therefore, unless and until we will not touch to the whole aspects of psycho, neuro, endocrinological axis, then it is just writing some medicines and therapy, and a heap of medicines may not solve the issue of infertility. Before understanding the pathological infertility, the physiological infertility to understand that we know before menarche or after menopause, there is a physiologically case of infertility or the condition of infertility persist, and even in the lactational period too. Then the pathological infertility has expressed in terms of the failure to conceive a live baby, even after 1 year of unprotected intercourse or the regular intercourse. So infertility has divided into a primary or secondary. Primary, which never the lady has conceived, and secondary infertility, that is failed to conceive after a successful previous conception. So the lady have another have an inclination to get the next chance, and that time she is not getting, then let's say coming under the secondary category. And according to Ayurveda, the infertility had understood that is a biological inavailability of the woman. So therefore, I told in the beginnings, it is not the woman health, it is the both women and men health to be understood. So during the reproductive age, contribute to the conceptions, and that state to not receiving, so not able to give the full term live baby, that is called as the infertility. So the statistical data, what is expressed here, is that infertility may be due to the male factor 30 to 40%. So female factors being that's the ashraya, that's the placement, so 40 to 55%, and sometimes the unexplained infertility, which is mostly related to the anxiety or psychological issue, that is a 10%. And those causes are related to, some are related to the hormonal causes, some are related to the psychological causes, some are related to the uterus, the fallopian tubes, the vaginals, sometimes the cervical regions. So step by step, so we'll go for the specific causes related to the infertility. So first cause, which is very dominant one, nowadays is that variety of kick we teach to the menarche girls that that nothing, no need to just stay inside the home during the MC cycle. So we just advertise to the paidmen and all. So now girls are very free during that menstrual period too. So high pressures or exertion or stress factors or workloads during that age without taking rest during MC cycle, that leads to the less amount of secretions and the MC flow, and that can leads to the PCOD or PCOS variety of problems. So that hyperandrogen androgen secretions leading towards the ovulations, and that is the lady sometimes complains that is heavy menstruation or there is no menstruation, amenorrhea. So that series of way we can diagnose the case of PCOS, and that can be presented through the hyperpigmentation or acne, and sometimes the hirsutism, alopecia. There are a lot of issues related to the PCOS. If we go to check 100 numbers of in a girl around the age of 17, 18, we may have more than 40% suffering the PCOS, and a very evident cause for infertility. So the possibilities has executed here, what I already discussed. Therefore, how we can make a hope by understanding the or analyzing the causative factors behind this disease. So the disease is based upon these all way. It is not just to fix or just to know about the condition of organs which are involved with the infertility. It is, we have to understand the financial condition of the family. We have to understand the social relations of the family, or the social relations mostly highly impact and influencing the lady itself, and what is the workload of the ladies, what is the health status, whether nutritional deficiency is there or not, what are the relationship, any sometimes the teachings in the family, the society, that can also create a depressions to the ladies, and that can be a very biggest cause for suffering infertility. Yeah, and we all know there is a long list of hormones involved for the conceived of child or the good health of the ladies. Therefore, any one cause cannot be just avoided. So there may be some thyroid problems, there may be some uterine problems that might be related to some operations, previously operations, adhesion to the uterus. Those all causes are tried to understand or try to analyze here. And before going to the detailed discussion about the infertility, one another term more famous, sterility. So sterility is actually not so similar to that word infertility. Absolute inability to conceive, irreversible loss of functional gametes, that is called as sterility. So there might be some follicles, there might be the follicular ruptures, but there is not some particular or very good functional gametes, and that because the persons or the either partner have infertility, that's a case of sterility we speak. So that's little grievous, we can say, comparison to the infertility. And so these are the some terms very frequently we use, that is fecundability. So fecundability is nothing or fecundity. The same or similar word looks like. Here is a differentiation that when one menstrual cycle, possibility of achieving pregnancy, that's a good conditions, and that we say in terms of fecundability. And in one single cycle, achieve a live baby along with means receive the pregnancy and have a live baby too. Then we say it's a fecundity. Now link with it in between the health of the women and men along with the nutrition is the biggest cause nowadays and observed in the patient. So the nutrition should be again proportionate to the property of the persons, the constitutional acceptability to the food. So it is not a genetic influence just because the lady or the gents have infertility. It is how he or she nurtures since from the childhood. all the environmental issues also impact on the infertility. So if we'll go through the classical textbooks, Bandhya Yoni Vyapad, Artava, Sruta Dushti, those all Nashtartava, Kunartava, then, or it has written in Susu Sangita, that is Puspagni, or Sejata Harini Yoni Vyapad, Acharya Kashyapa has written so many numbers of terms under the Yoni Vyapad and Arthavadushti. So those are the classical terms has written in our classics, and that's because it linked through all the way. Say Jata Harini in the sense already Janma, already there is fetus, and it is still kicking or killing, and repeated abortion is there. So such terms also has kept in the following syllabus slides. And there is a say Bija Upaghata. So Bija Upaghata, Bija means sperm, and Upaghata means destructions. So if destructions are unmaturated sperm and ovum coming to the circulation, and that unable to form the zygote, or simply puspa ghata. Puspa means flower in the sense ovum here. So if ovum is not there, or sometimes there is menstrual cycles, no ovum, sometimes there is no menstrual cycle too. So those all are the causes written in classical context. I took some clinical treatment aspects. Sometimes the treatment responded to the Sodhana Chikisa or Basti, or sometimes Palasadi Asthapana Basti. It proves that these all are possible, or these medications can give a good size of follicles or ovums, and the ovum rupture is good, and the fallopian tubes or the fimbria of the fallopian tube can catch the ovums after its ruptures, because the Vata Samana is there. So that's a way to understand the pathogenesis, a reverse way how we can understand the pathogenesis. So sometimes the treatment response to the Vata, Vata Samaka Chikisa, treatment response to the Basti, treatment respond to the Raja Pravartaka medicines, treatment respond to the Balya Aushadhi. So being we are observing in our clinical practice the Balya Aushadhi, the Raja Pravartaka Aushadhi, the Ushna Tikshna, sometimes medicines also show the response to in the patient. So that's showing that infertility itself is Tridosa Janya Vyadhi. So it's a vitiations of Tridosa can leads to the infertility. It means we have to give a precautionary measurement, not only to the Vata dosa, because the Vata Khetra, Apana Khetra, we also have to take care about the Pitta and Kapha too. And going to the other medications, we can see here there are some Ushna Tikshna medicines like Lata Karanja, some Sita medicine also. We can see here that is Sunti, Maricha, Pippali, Lasuna, Satava, all are the Ushna. It means they are here, ovum is there, but good rupture is not there. Or sometimes the size is not good. So those all way we have to take care of the all three dosha. Say here the medication has given like Nagakesara, Tiko2 are given for the ovulations. So there is a mature ovums, but it is not brushed out. There we need the Ushna Tikshna medicines. Therefore we can see that Tiko2 has added. Sometimes the maturity is not proper. So being maturity is not proper, the ovum size is not getting, and therefore we need some Madhura Rasa. And along with Madhura Rasa, we can see the Tikta, because Tikta Rasa is a Bata and Akasa Mahabhuta dominancy. So it will channelize the things. So those all way we have to look at the disease. This percentage has already told. And when we are taking the history of the patient, that times we should not just separately take the history. So we keep both the partners togetherly, talk together, counsel together, investigate together, and also we should discuss about the financial expenditure of the whole cost of the treatment, because it's highly essential to control their psychology. Therefore, it has written in Chara Sangita that Saumanasya Garvadharanam. And this is one reason. So the why during the after the coitus, why the expulsions or the kick out of the semen takes place. So this muscles spasms and never permit the semen to deposit. So how we can do the Vata Samana Chikisa, and we can control that disease. And therefore, not only the physical, even the emotional hatredness, that also works for the kick out of the semen or the kick out of the sperms from the place. So coming to the next conditions, that sometimes a very painful conditions during the coital exercise. So that times the retroverted uterus itself just stretch out the ovary, and that go deep into the Douglas pouch, and therefore the pain is there. So very severe dangerous pain. Ladies sometimes rejected the sexual relationships, So those all to be observed. So there might be sometimes the abscess, sometimes the salpingitis, because there might be some operative procedures, and because of which the scar is there. Sometimes because of the tubercular region is there. So those all regions to be rule out. And say this is the heavy swellings. So because of the heavy swelling, if you are giving some treatment to rule out the swellings, then there might be fibrosis sometimes. So the whole fallopian tube should be very loose, and that should be very fluent flow in the pelvic cavity. It should be rigid and straight uterine tubes. Then it cannot be case the ovum itself. So anxiety is the very biggest cause, because conception does not related to the genital tract itself. It also connected to the productivity of the whole connections between the brain, the hypothalamus, the feelings. What people around to the ladies is actually feeling about it. So all the vibrations, all the energy conversions around to the other family members that role on the psychology of the ladies itself. And inability to control, not only ladies, gents also, because gents never express the things. So inability to control mind and emotions, taking tough decisions in the tough situations, sometimes impact on the conception itself. So that inability to convert, the failure to the success, that variety of training and counseling is needed. It's necessary to learn the development of tools in all those negative atmospheres, how they can come out of the situations. Because the humiliative forces are always in the family, and convert all those painful moments of rejections into the projections, or of how the cheerful conception can be. So that stop to wait, somebody will come and somebody will change those all psychology. That is, we have to counsel both the partners in that way. So sometimes people take the help of alcohol and all. That is how harmful for all these hormonal control, that those all things. Then the treatment, the patient education is most important. So that's why it has written that is psychological cheerfulness can help can work by the catalytic movements in the conceptions. So that variety of relationships should not persist within them too. So what I like to introduce here, that the Putreshti Yagya earlier was done by Dasarath. So those Agni should work like a perceptions or the conception itself, and it should work like a Putreshti Yagya, Agni in the Putreshti Yagya. There's a known case of PCOD, how we can diagnose how earlier, and early catching of those varieties symptoms can protect the health to prevent the infertility. I told already about the hypothalamus axis, how control or how can protect the health on the patient of infertility. And say we can see here luteal phase defect itself. So the follicles, immature one, can come to the for the embryo formation. So that may not give a satisfactory conceptions. And sometimes the progesterone deficiency, that follicle itself will not burst, that the ovum will not come out. And there might be some endocrine issues. We know that is the resistance to insulins or the hypothyroidisms. That is again another case. So that leads to the excess of prolactin secretions. So that they are again that hormonal disbalance may not give a mature ovum itself, and even the problems to the implantation too. So this is the way, the axis through which it controls the whole MC cycles. So because the disturbed MC cycle, it secretes the gonadal hormones and stimulate the pituitary. So gonadotropins that secrete and disturbs the FSH and LH relationship and act on the ovary, and that leads to impact on the follicle will not break and the ovulation will be disturbed there. So sometimes peri-ovarian adhesions. So that is not actually permitting the ovary to freely move, or the fimbria to catch that ovums. And there are sometimes there might be the ovulations, but it will not release out, and the tube fail to catch that ovums. And some tubular factors. So there are long history of tuberculosis. That long history of tuberculosis leading towards the adhesions to the tube within the tubes, and that can be a cause of the infertility too. And next one, some uterine causes are there. So uterine causes, a long list has written here. Sometimes the congenital anomaly of hyperplasia or septum in the uterus, and the intrauterine adhesions, the some say there was a aversion, and because the aversion there is a curettage, and during the curettage the basal layer curate itself can give another like a permanent variety of infertility, and the obliterated uterus that also prevent the embryo to nidate in the posterior wall of the fundal part, and say that because of some operations, the post myomectomy that can create an adhesion itself. So the long list of infections too. So that infections can create the scar like, and that scar itself is preventing the nidations or sometimes the ciliary movements itself. So we can see here how the basal layer has decayed, and that is preventing the embryo to nidate in the uterus. So this we can see that tilted one uterus that is not permitting the content to stay there or to enter into into the path, and that is a aggressive movements of the sperm which actually stop or prevented. So here we have discussed that about the fallopian tube obstructions. So fallopian tube obstruction itself again not permitting the egg to enter or to fuse with the sperm itself. So if there is a tumor, so tumor even to the end of this means towards the os might be manageable sometimes, but if towards the fundal part it is not manageable, it immediately evacuate the not permitting the nidations or sometimes evacuate it out. If the fibroid or multiple fibroid, that's definitely it needs some surgical treatments or it needs to remove out. Rather that can be a grievous cause for or very important cause for the infertility. So I already discussed about the infective conditions. So because of this variety of infections, it makes some permanent scar and that prevent the infertility. So it is not only that way, even the endometriosis. So that is a very biggest cause. It never permit to maintain the good pH, the length of endometrium itself. Those things prevent the fertilizations, and therefore the things go out. And there are some cervical causes. So cervical causes, the biggest cause is that if any regions, the cervical amputation is there. So if there is cervical amputation, so the semen content never just stagnant for a long periods, or specifically the problem is the motility of the sperm. So sperm should be aggressively entered into the path, and that is prevented. So it make the sperms non-motile. So non-progressive motile sperms. And if this is a cause, another things we can discuss here, that sometimes the people who are habituated to take carpas oil. So carpas oil it is observed the tail of sperms itself joined together and prohibited. So it's not a cervical cause, but it's a cause related to the male partners. So it can also prevent the because we need within a stipulated time that journey should be completed. So it should go for the fusions with the ovums. And if long times in the travels or the wrong, so that instead of instead of going aggressively, they just go around. So that can let in the time of fusions. So the sperm motility in the different grade has shown here. And proceeding to the next slide, how we can understand. So this is the way the aggressive sperm should complete the whole journey, and within that stipulated time, there should be the formations of embryo. And next about the pelvic adhesions, as we have discussed, the pelvic adhesion itself never permit the fragile movements or the very soft movements of the spasmodic movements of the fallopian tubes, as well as the travel of sperm itself. Some other causes as discussed here, like say peritoneal causes, the peritubular pelvic adhesions, the hostile environment, the pH are not good, and some chronic illness like the nutritional deficiency and all hypothermia we have discussed already. So sometimes, as I told, the tube itself is a straight tube, and it also can prevent. And the height weight, very simple cause, but it should be checked. So height weight of the ladies or the gents can prevent the hormonal imbalance, or those have a big answers for the questions of infertility. So in the present day, women are more busy with multiple numbers of tasks or official responsibility and stressful conditions through which they pass, that unhealthy situation sometimes they, in the working site itself. So socio-psychological issues related to the women health to be educated or to be passed to the consumers, and we should take care about the patient in whole aspects. So Nidhana Parivarjana main the key whole of the whole treatment protocol. That's why I was planning to share a case study, but what I thought that whatever the classical terms as written in Sangitas, that to be upgraded and have to be discussed. So some terms we should discuss again from the Sangitas, like say Yoni Vyapad. So there is some concepts and issues. The Artavavaha Srotas disturbances. So that can be correlated with the amenorrhea condition. Yes. Yoni Arasa, the polyp in the Yoni Pradesha. So that can also prevent the entry of the sperm cells. So Garbha Kosa Bhanga. So that is the retro displacement of the uterus itself. Skhalita Mutra. So gonorrheal infections to the urinary tract. So that those all terms are there. Bhaga Sankocha, the constriction to the vagina. Utkipta Yoni, the retrovirginal uterus. Ati Charana, excess coitus. That can be again a cause of infertility. Bhamini Yoni Vyapad, Bhamini, Bhamana, Ulti. So that's a vomitings. The semen will not receive. It will be vomit out, or it will expel the live baby too. Ati Charana Yoni Vyapad. The excessive coitus itself also can be a cause. And that the next is Putragni. Putragni. So already the embryo has formed, but still repeated abortion is there. Sandhi Yoni Vyapad. There is some congenital, congenitally the baby will be, or even though the baby will have a infertility in her life. And mana avitava, bisada, bhaya, soka, krodha, those manasika factors also to be discussed. Sukra dosa, the qualitative and quantitative measurements of the sukra or semen also impact on the infertility. Ahara dosa, the nutritional deficiency that can impact on the egg size or the fluid content. The fluid is not proper secreted, then also can create problems. And akala yoga. So Akala Yoga, the time factors should be very proper. The ovulation time periods that should be properly calculated. So in case of PCOD, we fail to actually calculate on which day they should go for the intercourse. And similarly, Atma Moksha. So Atma factors. It is written in our classics that it is not the problem of this life, even the problem of previous life impacted on the infertility. And Jata Harini Yoni Vyapad. So Durdhara, Kalaratri, Nakini, those variety of terms has written in Sangitas. That is how repeated expulsion of the baby and repeated abortions takes place. So if we will think about those all conditions, Daiva Prakopa. So Daiva Prakopa means some causes are yet not understood. That variety of causes are also there in the classics. So that is called as idiopathic causes. So that can be another category. And Bija Dushti. So damage to the ovums or the sterile pregnancy, those also can be considered. And Samsodhana Vyapad can be a cause of infertility. So Bhamana Virechana has given 2 Amrudu Kosta persons that can be again create a infertility in the lateral stage. So including all those classical regions and comparing with the contemporary understandings of vaginal factors responsibility, cervical factor responsibility, uterine factor responsibility 10%, tubal factor responsibility 25 to 30%, ovarian factors responsibility from 30 to 40%, peritoneal factors 5%. Sometimes the coital error itself is the cause of infertility. So to conclude, we have to approach both the contemporary as well as the classical regions for the infertility. Understanding those, propagating those to the consumers will be a right approach for on this periods of 2020 or on this era. We cannot seek to bring the solutions of 21st century by using the previous understandings of just simply keeping the saying that our past glorification is good and fine. So we have to put that whole world is expecting running towards a scientific approach of understandings. So thanking you all for the kind listenings, and my special thanks to the organizer, Global Ayurveda Conference LLC, and hosted by associations of Ayurveda professionals of North America, including USA. Thank you to all.